Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, there's a bill introduced that has been introduced into the Pennsylvania legislature that would allow the larger public universities, I hate to use this word, to secede from the state system. We're going to have a special report on that. And then Andy Carter, he's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania, will be on this set. We're going to talk about Medicaid expansion. It's huge, it's important, and it's all going to happen very soon.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, welcome back to the program. First, we're going to start with what I think is a very, very important story. It's sort of led the news in many parts of the state, and it has to do with a bill that was introduced in the legislature that deals with the state system of higher education. That's the 14 publicly owned universities, Westchester, Cheney, I can't go through them all, Millersville, Shippensburg, Clarion out west, Slippery Rock. I'm going to catch you know what because I didn't get all 14. But joining me to talk about that is Mary Wilson from Pennsylvania Public Radio and Tony Romeo, KYW, KDKA. Now, I've got to point out to you that a long time ago, I was president of the Faculty Association and involved in the passage of the law that we're now talking about amending that would allow universities of a certain size to secede. Tony Romeo, I got that right?
Yeah, that's a pretty fair way of putting it, although I guess you wouldn't be a total secession because what they're talking about is allowing these state-owned universities to become state-related universities like
Pitt,
secession
Penn State. From the system.
From that system, sure. Yeah. I mean, basically what's happening here is that there are 14 of these schools and some are doing better than others. In particular, Westchester University in suburban Philadelphia is doing very well. And Tommy Tomlinson, who is an alum of Westchester and on the board,
senator,
and on Westchester's board of governors or whatever it's called, he feels that Westchester's ability to be nimble in response to its growing student population, the ability to do that is constrained by the state system's overarching governance board. And so he wants to allow schools like Westchester, as you said, the larger ones, to have this transition, if they choose, from being state-owned to state-related.
Yeah, Mary, the reaction has been kind of fascinating. I've picked it up. It's also, I think, co-sponsored by State Senator Andy Dinniman from Chester County, who also, by the way, was a professor at Westchester. I knew Senator Dinniman, as they say, back in the day when he was a history professor at Westchester. How would you characterize the reaction in the legislature?
Mixed, circumspect in some corners, and pretty much very opposed in other corners. So you've got the union representing faculty at the state universities opposed. You've got the chancellor of the state system opposed. You've got so far, mostly Democrats saying that they're pretty suspicious that this could work. And a lot of people, what are their concerns? Well, what does this do to affordable education at these universities, both the ones that would secede from the system and the ones that remain? What would this do to the health of that system? Does this mean kind of the mission of extending that affordable education drops off the side? There's this really interesting other piece of this that Tony touched on, which is that, the whole reason a school like Westchester might be unhappy within the state system is that they don't have the autonomy. The trustees, people at that university, running the university, don't have the autonomy they want to cut costs and cut the red tape and offer even academic courses that they think reflect the employment opportunities in their area. To me, that's like kind of a fascinating piece of this story. When you look at the declining enrollment at schools in the West, is it because there's no employment opportunities? Is it because there's, it's just a population decline over there? Or is it because those schools aren't able to offer courses?
Go ahead. No,
well, another fascinating aspect of this that Senator Tomlinson brought up yesterday was the fact that he sees the state system as now trying to brand itself. He mentioned the fact that they have opened up a branch or a campus in Center City, Philadelphia, with their own name on it, whereas Westchester and Cheney, he says, had wanted to partner to do that, and the state system said no, and went ahead and did it themselves. Yeah. And so Senator Tomlinson says he thinks it seems like the schools within the system are now competing against the board that's governing them.
Against the board is good. Yeah, I mean that's certainly a possibility. Now, this bill was just introduced. Mary, you pointed out that the reaction is mixed. Have we heard anything from the state-related schools if they would become, and I'm not sure, I've read accounts of it, I've not actually had a chance to read the specifics of the bill. It looks like they're creating a kind of hybrid. The one report I read said that Westchester, let's assume that would be one of the schools that would leave, or any school that would leave, would keep the appropriation at the level they had before. That would be a guarantee, and they'd have to buy the property back.
Right. Over 30 years.
Yeah, but I mean, we're talking about a huge sum of money there. And did any of you hear any reaction from the state-related? Let me ask that question.
Well, I think the head of the system is opposed to it. But I think basically what you've got here.
But Pitt, Penn State, Temple, and Lincoln.
Oh, the state-related.
Yeah,
sorry.
We
haven't heard anything. No.
I haven't heard. And what's interesting is you've got, exactly what a seceding school would get from the state after this. I think is one of those things that will be left up to negotiation. Right. And obviously, we're not there yet because this has just been.
All right, we're at a break. But do any of you expect a Senate? I mean, that's an unfair.
Well, there's a hearing coming up.
There's a hearing coming up.
The hearing's been scheduled.
But there's no indication yet this is on a fast track. Let me just.
I wouldn't say it's not on the fast track. I asked that question of the spokesman for the Senate Majority Leader. He wouldn't say it's on the fast track, but he says it will get serious consideration.
All right, we have a couple of interesting stories coming up. I'm going to give each one of the reporters a chance to weigh in on one. Catch these when we come back.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back with Tony Romeo and Mary Wilson, both we have two radio folks on here. We were talking about that before. They're very happy about that. At any rate, I'm going to give each one of the journalists a chance to weigh in. Tony Romeo, the Pope is coming. The Pope is coming. What do you think?
The folks in Philadelphia hope. Governor Corbett and Mayor Nutter last Friday announced that they are going to. Friday before we're making the show, announced they're going to go to Rome and meet with the Pope, or hope to meet with the Pope, to try to convince him to come to Philadelphia when he comes to the United States.
But I mean, this Pope is very different. He's got a unique style about him. I think you'd have to look at this and imagine this would be a big deal. This might be better than having the conventions come, the political conventions come, right? Maybe less controversial.
But would it be as good as a Super Bowl? I'm not going to go there.
I know. All right, Mary, there's a state Senate race playing out in New York. Maybe there is one in New York too. In York, Pennsylvania, that involves a kind of replica of what we see going on all over the country between the traditional Republicans and the more ideological based or Tea Party, even though this one of the give us some insights into that.
Okay, so a York County Senate seat, the senator resigned in January, stepped down, took a job with the Farm Show. That was State Senator Mike Waugh. So stepping in to run for that seat is a House member, Ron Miller, Republican Representative Ron Miller, endorsed by the party. He's got their nomination.
For the write-in.
And then the write-in candidate is Scott Wagner, a very wealthy owner of Penn Waste, businessman in York County. He's running. He's also one of the major donors to a group called Citizens Alliance of Pennsylvania, a very conservative group that really pushes this message of pension reform, small government. Legislators should be rejecting the perks of the job, that kind of thing. And so in a county that, as I've it's been most recently described to me as a district where Republicans usually get about 65% of the vote and Democrats get about 35% of the vote. Well, now you've got these two Republicans duking it out for the vote in a special election right now, which is going to be on Tuesday.
Right.
And so it might increase the chances, the likelihood that the Democrat...
But I mean, it's sort of indicative of what we've seen, not just in our state, but around the country, of these divisions. And we'll see. But then there's also the nomination for the full term, right? And there's a primary going on there as well between Wagner and Representative Miller, correct?
Right.
So we'll see what will happen. All right, great update. All right. Andy Carter's coming on. I'm going to chat with him about Medicaid. I think we're going to get Medicaid expansion. I'm going to ask Andy Carter. I'm going to put him on the spot and ask him what he thinks about that when we return.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Well, Andy Carter, he's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania, is with me, and I boldly predicted something. I'm going to put to Andy Carter. I mean, look, we've been having this debate between two different kinds of Medicaid expansion. In the polls that others have done, including me, and I'm being, neutral about this, the voters want this. I mean, the voters of our state want it. So without getting into the weeds, we have two different types of possible expansion. Just go through the highlights of them. So Medicaid expansion, we're talking about, what, 500,000 people at a minimum, would you say?
If we get it done, it'll be 500,000 more people will enjoy coverage. So there are two ways to do it that we're seeing. Some of the states are doing a straight Medicaid expansion, taking the existing program and just raising the income eligibility ceiling and adding those people to the Medicaid rolls. In Pennsylvania and a few other states, the governor in our case wants to do it using the private sector to a much greater degree and doesn't want to just take the existing Medicaid program and add 500,000 people to it. He has announced an intention to try to also reform Medicaid and make it work better for patients and work better for taxpayers. In the end, the hospital community decide we'll support either version of getting it done. And Pennsylvania is choosing the second approach, and we can get behind that.
Yeah. Now, one of the things that I hear all the time, and I think it's certainly true, is that doctors often treat patients that come into them, and they have little resources, if any, no payment. You are required by law, correct me if I'm wrong, but you probably, I mean, hospitals ain't, as we say in Lancaster County, ain't kicking anybody out anyway if they come in with a serious. So you're treating them anyway and not getting reimbursed for them.
It's to the tune of about $1 billion a year of charity care and free care and bad debt that hospitals absorb. And that's just no way to run a railroad, because we can't organize health care in a sensible, coherent way when that many people are uninsured. And so the charm of getting all these folks covered is that they can have access to health care earlier, and then make sure that if they start developing a condition, you can get in there fast.
Yeah, that's a great point. I mean, one of the advantages, it seems to me, well, first of all, I think the voters have told us, I mean, look, no one wants little kids not to have health care coverage, not to get vaccinations, not to be, I mean, that just in a society that just makes no sense. And I'm not, I mean, it's just what the polls show. But the bigger point is that, and correct me if I'm wrong, if they're being treated regularly, isn't in the long run it less expensive to do that than if they show up in an emergency room with some acute problem that might have been taken care of earlier if they had been seeing. Go ahead, finish the thought.
I mean, it's true. There's lots of research that shows that people who have insurance coverage do better over time than those folks who go without any insurance coverage. And Pennsylvania can take a lot of pride in the fact that it has been a champion for children's health care for years, through the CHIP program. Right. And the governor has taken steps recently to strengthen CHIP even further, and that's a good thing. What we still have ahead of us is to get essentially everybody covered and get everybody the preventive care they need to avoid getting preventable diseases, preventable illnesses. And over time, we can see a reduction in what we're spending on health care. No one wants to spend too much on health care, especially since consumers are over time going to be picking up more and more of the cost of health care.
Right. One of the other dimensions of this, I thought that the governor has this Healthy PA program, as Andy was mentioning, and in that program, which is similar to one that Health and Human Services accepted for Arkansas, but his program had a work requirement, mandatory work requirement, and they've notified HHS that they would drop that. Is your sense that dramatically increases the prospects for it? It has to get federal government approval.
It does. I think the governor is demonstrating a genuine commitment to get this across the finish line. And I think to do that, both the administration here in Harrisburg and the federal administration have to negotiate their way through the details of this application. I think we're going to get there. There's too much drive, and it's not just what polling shows. It's what healthcare providers are saying. It's what patients are saying, that we need to get coverage done.
And the state Senate, in a bipartisan vote, did pass a traditional Medicaid expansion last year with bipartisan support, correct?
With a few caveats that took it a little bit off.
Yeah, there were 14 different exceptions, but they seemed to me that something, to use a word, they could be massaged, right?
There was strong,
do you agree with that?
Absolutely,
Yeah.
And there was strong support from the Senate, and even in the House, which failed to get it across the finish line last June, there were still strong words of support for it. We just couldn't get it to a majority vote. But I think that once this gets done, and the fact that the governor has structured it in a way that is unique to Pennsylvania should kind of stem the level of angst that we saw unfolding last summer, and people get behind it. Once we get people on coverage, I think you're going to see all the anger that we've heard.
Well, it's emerged, I think, as one of the important policy issues in the state, and I think that voters have indicated all along with education and health care, and Medicaid expansion as pretty important issues. All right, hospitals are undergoing considerable changes, and are mostly in many ways, but certainly in terms of what they can do to fix quality and improve health care. We'll talk with Andy Carter about that in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, well, I'm chatting with Andy Carter. He's the president and CEO of the Hospital and Healthsystem Association, sometimes just referred to as HAP. You often hear that as an acronym. Let's talk a little bit about jobs. And hospitals are big employers, often along with educational institutions, higher ed. Your college and university and hospital. Wow, I mean,
You know, across the state, our members employ 270,000
Wow.
Pennsylvanians. And then there are jobs associated with hospitals. You add them all up, you're talking about almost 600,000 jobs that are tied to hospitals in our communities. So we're major economic drivers. We contribute overall about $100 billion to Pennsylvania's economy. So when we take a look at how we have to respond to what consumers and businesses are asking, which is cut costs.
Right.
We have to find ways to do that, recognizing that we have a commitment to community health, and we have a commitment to our employees. And what we want to guard against is...
And quality, as we're going to talk about in a minute.
We'd love to talk about the tremendous work that we're doing to make your stay at a hospital safer and better outcomes. That's job number one for hospitals. But, you know, as we look at the landscape, we know that there are people that want to shave costs. And we just have to, if we're going to reduce costs in healthcare, we got to do it over time, and we got to take our time to do it right. Because number one, we have a pledge to our communities to provide high-quality healthcare. And across the whole state. You know, we can't have huge pockets of Pennsylvania where there's no hospital that's a reasonable distance from your home. And that matters to people.
That's
How long
like
is it going to
doctors
take?
and specialties. The same kind of analogy where, you know, you need family doctors, you know, or specialists. I mean, folks have to go. Well, what? You have to go how far? 60 miles?
Yeah,
you know, and the same with a hospital, right?
It's a problem for Pennsylvania. We do have an emerging physician shortage, an emerging nursing shortage. Fortunately, the Governor's Health EPA program is trying to address that, like, for example, loan forgiveness programs to encourage docs to stay here in Pennsylvania. Otherwise, we're going to have longer wait times, and this is something people care about. How long does it take even to get an appointment? So we got to make sure we continue to invest in attracting good physicians, good nurses, good physical therapists, and keeping them here in Pennsylvania.
Yeah. Now, is that going to lead to sort of more satellites or smaller facilities as opposed to these, you know, obviously the traditional big brick and mortar? Is that one of the trends that you see?
You need a combination. You need to have those brick and mortar foundations, but we have to have access even outside into our rural communities. And there are strategies for doing that at relatively low cost. And again, another smart strategy happening here in Pennsylvania is telemedicine. You can take a very highly trained, very specialized physician in one of our major urban centers and connect them 50, 60, or even thousands of miles away to a patient using telemedicine technology and high-definition television. It's phenomenal what we can do to get care to all pockets of the Commonwealth. And we have to invest in that infrastructure. It takes a lot of infrastructure to get telemedicine implemented. So Pennsylvania is doing some of that work to get that infrastructure in place.
Well, we're out of time, but I mean, this has been, I think, a wonderful update for our viewers. And you'll come back, you know, when your schedule, when you can work it into your schedule, and let's talk a little bit about sort of the quality changes that we didn't get a chance to talk about. I think that would be very helpful for our viewers. Thanks for coming in.
Thank you.
All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.